And while we're on the subject, did I get straight? I got my shot. I did. I'm so excited. I got the Johnson & Johnson one-shot vaccine. Can I just tell you about it for a second? I went on my own, so I didn't have anybody take a picture of me, let alone me dancing like Chris did when I was getting the actual shot. I don't think I would have liked to see a picture of me getting the actual shot anyway, because I am afraid of needles, and so it would make me throw up if I saw a picture of myself getting an injection. But I did take this photo of myself right after I got the shot, right as I sat down in the waiting area. And I know this is a terrible photo. I'm wearing my old battered West Point baseball cap. I totally forgot I had put a bright red binder clip on the left side of the bill for safekeeping. That's what's up there on the side of the brim. See that little red metal clip? I'm such a dork. This will be like forever, my vaccine photo. But if you will notice, I look a little crazy in the photo, even beyond just the weird hat. And it is because I was sitting there bawling my eyes out from relief and gratitude for being able to get the shot. I kept having to sneak a handkerchief up under my mask so I wouldn't totally soak it while I just sat there crying for half an hour. As for any side effects, I actually feel totally fine. My arm hurt a little bit right after, and I felt a little woozly. I know there have been reports in the past few days about a few people in a few different states feeling bad after they got a Johnson & Johnson shot. That may be. I'm fine. And honestly, my woozliness, that sort of lightheadedness, might have just been because I was so emotional about getting it done. Also because I am scared of needles and I get woozly whenever I see them. I'm not going to go on about this forever, but I do just want to say a thing about the vaccine. I feel like there is a sort of discourse in the American media, in the normal media, not the conservative media, which really is still mired in all sorts of disinformation and nonsense about COVID, including about COVID vaccines. But in the rest of the media, in left and center and everything but hard right crazy media, I feel like there has been a lot of sort of patronizing, snobby discussion about people who don't really want to get the vaccine. I will just tell you, I know a lot of people in my personal life, people in my marching order, my peers, people I love and respect and have a lot in common with, who feel oogie or a little reluctant to get the vaccine. In addition to that, lots of people in my life are super eager to get it and have been scrambling for an appointment and couldn't wait to do it. But alongside that, I also know a lot of people who are just hoping that nobody will notice that they haven't gone because they're still mulling it over. They're kind of dragging their feet about it. They're kind of dreading it. I just want to say that is not anything to be ashamed of. Feeling that way, whatever you're reading in the media or hearing in the media, feeling that way, feeling a little oogie about it is not necessarily born of you, having some rank ignorance or because you've been drafted into some conspiratorial anti-vaccine movement, although there is one in this country. I mean, for me, I am a person who is legitimately afraid of needles. I have passed out and fallen off my chair from getting injections and from having blood draws in the past. I absolutely hate it, and I get that part of it. Incidentally, I am also generally a stay away from the doctor for everything person. I don't take any medication that I don't absolutely have to, and I try to limit any amount of time that I have to take anything. Also, I hope this isn't too personal, but I had a specific worry about the vaccine. I, about 4 years ago, had a really bad allergic reaction to a shot that I got. It wasn't a vaccine. I had a back injury. I got an injection for that, and it went quite wrong. I had a real scare with that. And even though I got the FDA fact sheets and I checked the ingredients closely of all the vaccines, and so I knew for sure there was no overlap between any of the components of the injection to which I'd had that bad reaction and what's in all of the vaccines. Now, even I knew there was no overlap. Still, I'm not going to lie, that made me worry. But look, actually, on that point, in this also terrible photo that I took, you can see, that's my shirt. You can see they put a second sticker on me. I've got my upside down vaccination sticker up there on my shoulder. But then next to that, you see it says Q/23 yes, 30 minutes. They put that on me because that means I answered yes when they asked me in the pre-screening whether I'd ever had an allergic reaction to a shot before. I had. Because of that, they put me through an additional medical screening, and then they put that other rectangular sticker on me indicating that I would have to stay a full 30 minutes instead of 15 minutes in the observation period after I got the actual dose. So they, kept an extra close eye on me for twice the usual time while I waited for that half an hour. And I don't know what they thought of me sitting there for that half an hour crying like I was reading the end of Old Yeller over and over again. But that's how it went. I had legitimate fears and ooginess. I felt the fear and I did it anyway. And so just listen, if you are like me, if you have been feeling oogie or resistant, or if you've just been dragging your feet about whether or not you're going to get the vaccine, I get it. You are not a jerk or some sort of fool or some conspiracy theorist for feeling that way. Lots of us have lots of reasons to feel reluctant or even scared, or to try to hope this is all going to blow over for everybody and we won't ever have to personally get the shot ourselves. I am right there with you. I totally get it. But here's the thing. Here's the thing that I feel like I have total clarity about now, having done it. It's not for you. You are not doing this for yourself. If you are at all like me, your own health, your own risk is not a big rational driver of all of your actions. Maybe you feel fatalistic, if I get COVID, I get it. Maybe you feel like your odds are good, that you almost certainly won't get a bad case if you do get COVID. Fair enough. If that's how you feel about your own COVID risk and you're weighing that kind of distant, not that concerning risk to yourself against all the very present ways you feel bad and worried about the vaccine, then, you're maybe thinking the vaccine feels like the more present danger. It feels like the more dangerous, the more onerous worry. I get it. I understand that balance. But you are not getting the vaccine for you, even if you don't care that much if you yourself are going to get COVID. I know you should care, but a lot of us don't, right? A lot of us aren't wired that way. We're risk tolerant in terms of ourselves. Even if you don't care that strongly about whether you yourself are going to get COVID, or it's a risk that you feel like you're willing to take, or you can't do anything about it, you feel fatalistic about it. What you do care about, what will move you, what does tip the scales decisively in favor of you going and getting that shot that you really don't want, is this. It's that you really do not want to be the person who gets it and then spreads it to other people, regardless of how you feel about the risk of getting it yourself. I mean, God forbid, if you don't get vaccinated because of whatever's driving your reluctance, I don't care. I understand. It's all reasonable stuff in many cases. But God forbid, if you don't get vaccinated and then you get COVID and you unknowingly spread it to other people who you know or who you encounter, and those people get sick from it or die from it, those people give it to their family members and then their mom or their dad dies from it because of you. Because you wouldn't get vaccinated. I mean, God forbid. I mean, could you live with yourself in that circumstance? If you had the choice to get vaccinated and you decided, nah, I'm scared, and then that decision cost somebody else that you know their life because they got it from you. It's not for you. I mean, if you get vaccinated, your risk of getting really sick or dying from COVID yourself, that risk drops to basically zero. And that's true with all the vaccines. But what is more important to me in the way that I'm wired, and what may be more important to you, is that if you get vaccinated, your chance of ever spreading the infection to somebody else just drops off a cliff. If you get vaccinated, yeah, you saved yourself. I know you don't care. More importantly, you have saved everybody else, because now you're like 90% less likely to get infected and to be able to transmit it to anyone else. So even if you don't want to, get your vaccine so you don't ever kill anybody with COVID. Yes, it will protect you, but honestly, it's not for you. It's so you don't kill other people. It's so you don't spread it to other people. Because how could you live with yourself if you knew that you had done that? I mean, are you scared of getting the shot? Me too. Get a shot. Is your fear of the shot really more scary to you than the prospect that you are going to be a vector, spreading a fatal virus to people around you? If you don't get that shot, just get it. Maybe you've told yourself you're playing it safe. You just want to wait and see since this is a new vaccine. No, 114 million Americans, nearly half the adult population in this country, has had a vaccine shot already. 114 million of us have had it. The number of people who have died from getting the shot is zero. Whereas the number of people who have died from getting COVID in this country is now approaching 560,000. So if you have been telling yourself this story that you're playing it safe, that you're not getting the vaccine because the vaccine is a relatively new thing, So you're playing it safe and not getting the vaccine. Think about it. If there are two paths, and at the end of one path, there are 0 deaths, and at the end of the other path, there are more than 500,000 deaths, which one's the safer path? It is okay to feel reluctant or oogie or scared and not want to get it. That is nothing to be ashamed of. But feel the fear and do it anyway. Get it. Because most of all, it is not for you. It is to keep you from getting it and then spreading it. Seriously. If I can get it and like have such an emotional release from the fear and anxiety and relief and gratitude about it that I can cry through it like a baby in front of lots and lots of other people, including lots of people in uniform, if I can do it, you can do it. I do not recommend this angle for your selfie, nor do I recommend wearing a hat with a binder clip on the brim, but you can do it. If I can do it, you can do it. So I will not talk of this again. But there you have it. Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.